There's a phone call that happens in doctors' offices across America almost every single day. A senior citizen, someone just like you or someone you love, sits in that little exam room, and the doctor says 5 words that sound so simple. Let's get your blood pressure managed. And just like that, a small white pill called Lisinopril becomes part of daily life. No big warning, no long conversation, just a prescription, a nod, and a see you in 3 months. But here's what almost nobody tells you in that room. Millions of seniors are taking this medication every single morning, and most of them have no idea about the small daily habits that can make it work better, or the quiet warning signs that mean something needs attention. Today, we're going to talk about what really happens when you take Lisinopril, the things your pharmacist wishes they had 5 more minutes to explain, and why understanding this one medication could change how you feel every single day for the rest of your life. If you or someone you love takes this pill, stay with me until the end, because there's one part coming up that catches almost every senior off guard. Let's start with why this medication became so common in the first place. High blood pressure is often called the silent condition, because most people don't feel it happening. There's no dramatic pain, no clear symptom screaming for attention. You could be sitting at your kitchen table, drinking your morning coffee, feeling completely normal, while your blood pressure quietly puts extra strain on your heart, your kidneys, and your blood vessels. That's exactly why doctors reach for medications like Lisinopril so often. It's one of the most prescribed blood pressure medications in the entire country, and there's a good reason for that. It belongs to a class of drugs that relaxes blood vessels, allowing blood to flow more easily, which takes pressure off the heart. Think of your blood vessels like garden hoses. When those hoses are tight and narrow, the water, or in this case your blood, has to push harder to get through. Over years, that constant pushing wears things down. Lisinopril helps widen those hoses, so the heart doesn't have to work as hard. On paper, that sounds simple. But real life isn't always simple, especially for people over 60 who might be juggling several health conditions and several medications at the same time. Here's where the story gets interesting, because this is the part most people never hear. Lisinopril doesn't work the exact same way for everyone. 2 people can be the same age, take the same dose, and have completely different experiences. One person feels fine. Another person develops a nagging dry cough that won't go away, something so common with this type of medication that doctors have a name for it. It's one of the most frequently reported reasons people ask to switch medications, yet many seniors don't even realize the cough is connected to the pill they're taking every morning. They just think they're coming down with something, or blame it on allergies, or worse, they just live with it for months without saying a word to their doctor. That's the first thing almost nobody tells you clearly enough. If you start a new, persistent dry cough after beginning this medication, that's not something to just push through in silence. That's information your doctor needs. It doesn't mean something is wrong with you. It often just means your body is responding to the medication in a specific way, and there may be other options worth discussing. Now let's talk about something even more important, something that quietly affects daily life for so many seniors, and that's the connection between this medication and how your body handles standing up. Picture this. You've been sitting comfortably in your recliner, watching your favorite show, and you stand up to answer the door or grab a glass of water. Suddenly the room tilts. Just for a second, you feel dizzy, maybe even a little unsteady on your feet. Many people brush this off as just getting older, but this can actually be related to how blood pressure medications affect the body, especially when standing up quickly. This is sometimes called orthostatic hypotension, and it's one of the leading hidden causes of falls among older adults. And falls are not a small thing. For someone in their 60s, 70s, or 80s, a fall isn't just an embarrassing stumble. It can mean a broken hip, a hospital stay, a loss of independence that can spiral into something much bigger. So here's a simple habit that can make a real difference. When you get up from sitting or lying down, especially in the morning, take it slow. Sit on the edge of the bed for a moment before standing. Give your body time to adjust. This one small pause, just a few seconds, can be the difference between a normal morning and a trip to the emergency room. Now, let's talk about something that catches a lot of families completely off guard, and it involves the kitchen. Specifically, salt substitutes. So many seniors, trying to do the right thing for their heart, switch from regular table salt to a salt substitute, thinking they're making a healthier choice. And in many cases, that instinct is good. But here's the twist nobody warns you about. Many salt substitutes are high in potassium, and this particular type of blood pressure medication can cause potassium levels to rise in the body. When those two things combine, potassium can climb higher than it should, and that's something that needs to be monitored, because too much potassium can affect your heart rhythm. This isn't meant to scare you away from healthy eating. It's meant to highlight why it's so important to tell your doctor about every single thing you're using, including something as small as a salt shaker on your kitchen table. Doctors can't manage what they don't know about, and so many seniors don't think to mention these small daily habits because they don't seem medical, but they matter more than most people realize. This brings us to one of the most overlooked parts of the entire conversation, something that deserves way more attention than it usually gets, and that's the relationship between this medication and hydration. As we get older, our sense of thirst naturally becomes less reliable. You might not feel thirsty even when your body genuinely needs water. Combine that with hot summer days, a stomach bug, or simply forgetting to drink enough throughout the day, and you've created a situation where dehydration can sneak up quietly. For someone taking blood pressure medication, dehydration can affect how the body responds to that medication, sometimes causing blood pressure to drop lower than expected, which circles right back to that dizziness and fall risk we just talked about. So here's something simple you can start today. Keep a glass or a water bottle somewhere you'll see it constantly, right next to your favorite chair, on your nightstand, near the kitchen sink. Building the habit of small sips throughout the day, rather than trying to drink a lot all at once, can make a real difference in how steady and clear-headed you feel. Now I want to gently address something that so many families whisper about but rarely say directly to their doctor, and that's the fear around kidney function. Because this class of medication actually affects the kidneys, doctors typically run blood tests periodically to check how everything is working. Some seniors hear the word kidney and immediately panic, assuming something is going wrong. But here's the truth. In most cases, these check-ins are simply a normal, responsible part of monitoring the medication, not a sign of a crisis. Think of it like checking the oil in your car regularly, not because you expect something to be broken, but because staying ahead of small changes prevents bigger problems down the road. If your doctor orders blood work while you're on this medication, that's not something to fear. That's your healthcare team doing exactly what they should be doing to keep you safe long term. Let's shift for a moment to something deeply personal, something that isn't talked about enough in senior health content, and that's the emotional weight of taking a daily pill for the rest of your life. There's a quiet grief that can come with realizing your body needs ongoing support that it didn't need 20 years ago. Some seniors feel frustrated. Some feel like taking medication is somehow a personal failure, as if they didn't take good enough care of themselves. If you've ever felt that way, even for a moment, please hear this clearly. Needing blood pressure medication doesn't mean you failed at anything. Genetics, age, family history, and years of life circumstances all play a role in blood pressure, and many of those factors were never fully in your control to begin with. Taking this medication isn't defeat. It's you actively protecting your future, protecting the years you still get to spend with your grandchildren, your friends, your favorite Sunday routines. That's not weakness, that's strength. Now here's something incredibly important that ties everything together.